Hello, I hope you all are doing well. My name is Dr. Janeé Avent Harris, and I am so sad that I'm missing the conversation in person, but so grateful that I get to join you all virtually. I just want to say thank you to Candace, first of all, for organizing this event. I am always excited when we are able to have dialogue about mental health and about mental health in the Black communities specifically, with emphasis on the Black church. And so I just wish I could be there to be a part of the conversation, but I hope this is the first of many, many more to come. Also, congratulations to you, Candace, on your practice, and I wish you much success in that. So, like I said, my name is Janeé Avent Harris, and I'm an assistant professor here at East Carolina University in the Counselor Education Program. I graduated from UNC Greensboro with both my master's and my PhD. My master's was in clinical mental health counseling, and my PhD has been counseling and counselor education. And so, what I do now primarily is teach and do research and service around mental health issues. And my research interests primarily have centered around African American help seeking behaviors with an emphasis on the role of religion and spirituality. And so I think it's important to provide a little bit of context to who I am so that you can kind of understand how I approach this topic. So I grew up as a church girl, so in church my whole life, and remember hearing sometimes that, oh, you don't need to go see a counselor or you don't need to talk to anybody about these issues. And so when I started my studies into counseling, I remember just kind of trying to reconcile those conflicting messages. And I remember it being difficult for me. And so my thought was, if this is difficult for me, then I can imagine that it is also difficult for our clients, or those who may be interested in seeking services but may not really know how or feel some sort of shame for doing so. And so that led me to look at this topic more and to try to figure some things out, both what's happening and what we can do to decrease the stigma. So I asked Candace to send me a couple of questions that she wanted me to address. I'm going to try to keep it short and sweet, but I invite you that if you want more information about any of the research that I'm doing, so please get in contact with me. Candace has my contact information, so I invite you to email me or call me, and I would love to chat more. So the first question is, how can the Black church leaders within the Black church become change agents with regard to mental health? Um, I think this is a great place to start because I think historically pastors have been such a central figure in our communities and in our churches. When I was doing my dissertation, I was able to even go back to slavery times. And many times the pastors were the only ones who could read. And so they were the ones who were able to teach others how to read from the Bible. And so historically, pastors have such a huge influence on us. And even if you think about civil rights, I mean, Martin Luther King Jr. was a preacher. And so I think that pastors have such a central role in destigmatizing mental health. My first research study, which is my dissertation, focused on pastors' perspective of help seeking. And interestingly, um, the majority of the feelings about mental health was positive. So they felt that um, they wanted to encourage their parishioners to go seek help. They wanted to promote good mental health. They wanted to make good connections with counselors. Ironically, when I started interviewing parishioners and congregation members, they didn't feel that same type of support or promotion of counseling. And so there seems to be a disconnect between maybe what the pastors think they may be saying and or what the parishioners think or they may be hearing. And so one of the things that pastors really can do is use the platforms they have to make good, positive, supportive statements about mental health. So if you are saying one thing from the pulpit and you're saying that, oh, you don't need to go see nobody or you're crazy if you feel this way, then that's what people are going to hear because that's typically one of the most powerful platforms. And so in your sermons, incorporate language that is sensitive to the mental health issues that are happening in our community. Be supportive of members who need to seek help and also know limitations. And I think that, I don't proclaim to be a preacher by any means. And so when I would have clients come ask me specific theological questions, often I would refer them to the chaplain's office because I thought they may be better served there. Similarly, if you are a pastor and you have not been specifically trained in mental health, it may be good to make good connections with the mental health providers in your community. And so that way you can have good people to refer your congregation members to, because I know you care about them. And so I think that's one of the most important things leaders can do. The next question is, what are some specific ways for the Black church and mental health professionals to partner with one another? This is one of my favorite questions because what I often tell counselors is that there's a reason why people are going to see their pastor and not coming to see us. And I think there's a lot that mental health professionals can learn from pastors. Pastors have this connection to people that is often inexplicable. And so I think that we can learn from pastors how to build good rapport with people. And I think that's a great place to start with the partnership. Similarly, I think pastors can learn from counselors. There are skills that we have that we're trained in that the other people just aren't trained in. And so with the combination of our skills, I think we can do good work. So a lot of times ministries have health fairs. And so those health fairs tend to focus on the physical health aspects and don't necessarily include mental health. And so one of the ways we can partner is invite a counselor to be a part of your health fair. Invite counselors to speak on Sunday morning. Similarly, professionals, go visit a church, specifically if you think about Black churches. Get to know the culture, and so that when your clients come in, they feel like you have some sort of connection with them and you can understand. So that's one of the suggestions I have. I think it's good for people to see pastors and mental health professionals together and collaborating. So some prevalence data about mental health issues within our communities. It's hard to answer this question because our data is mixed, and that's for a variety of reasons. So what we know is that African Americans tend to seek help less than other racial ethnic groups. And what we also know is that they tend to seek help from spiritual and religious leaders when they do seek help. So if we kind of break the data down a little bit, when African Americans do go seek help, oftentimes they are either misdiagnosed or overdiagnosed. So for example, and one of the reasons this is because oftentimes African Americans don't seek help until the issue is so severe. And when they do seek help, they present at places like emergency rooms versus a counseling center. So something that may be anxiety and or depression is then often misdiagnosed or overdiagnosed as one of our more severe mental health disorders such as schizophrenia. And so I think that it's hard to kind of quote a number. What we do know is that African Americans are not less likely to have mental health issues than anybody else. So there's stuff happening. A, either no one's talking about it, B, or no one's getting help for it. I think another thing that makes the data kind of confusing is that a lot of times African Americans don't use words like anxiety or depression. So if you grew up like me, you heard, oh, I'm going through, or this is a test, or this is a trial, and clinical language would be anxiety or depression. So there's that mismatch as well in language. So I think the data needs just to be teased out a little bit. One of the interesting things that I found through my research is that even when you control for a lot of variables, let's just say education, let's say access, let's say income, race still tends to be one of the biggest predictors of whether someone will seek help or not. And so I think there's a lot of opportunity to figure out the why behind that. And a lot of that why I propose is because they tend to seek help from churches more often. So the data is a little mixed, but I think what is also important to note is that African Americans have a lot of risk factors. So we're more likely to encounter some of those physical health issues like high blood pressure, heart disease, things like that, which oftentimes are tied to anxiety and depression. Violence in our communities leads us to experience bereavement in a way that maybe other racial ethnic groups don't. And so all of those things make us sensitive to mental health issues as well. And so I think there's a need to normalize. One of the things that I focused on in some of my research was the idea of bereavement. And when someone dies, we want to say, oh, the funeral is the finale. Like, that's the culminating factor. We should be okay. We should get back to normal. We should celebrate this person. Even our language of homegoing, like, let's make it celebration. And as a Christian, um, I agree with that. I agree with that notion. And I think there needs to be room for people to grieve properly. And so when we don't allow people to grieve properly, or we don't allow people to grieve, those things can manifest into depression and or anxiety, or even just normalizing that. You know what? You're not just not gonna be happy after the funeral. There's gonna be some days you wake up crying. There's gonna be some days when you're like angry. And so being able to normalize that for people and providing a place to process is very important. So anything else that I wanted to share? I want to just say that I think what's important is that we are starting to talk about this. I'm seeing a lot of articles being written through social media, different things like that. But I also think that what I'm finding is that there's this willingness to seek help, there's this openness to counseling, but it's not always this follow through. And so our work needs to be in the follow through. And I think churches have such an awesome opportunity to partner with mental health professionals to help with the follow through. And I think it's about having good access to mental health. And so I saw the other day that a pastor, I think it was in New York, they got a grant to open a practice within the church. So people who that church was in their community could walk there to get good quality care. And so I think that's a part of the follow through. I think also a part of the follow through is having people who are from the Black church go and further your education and become counselors, because you're able to reconcile these two worlds in a way that you could connect with people and do good outreach with people. And so I think that's a part of the follow through. I think not using words like, oh, you crazy, or not shaming people for seeking help is also a part of the follow through. I think balancing religion and spirituality with formalized help seeking is also a part of the follow through. And so there's a place for praying and there's a place for going to see a counselor. And I think we should make room for both. And that's on the mental health care professional side as well. We shouldn't minimize or make people feel bad because they say, oh, I'm going to pray about this. Yes, that is a part of it too. So I think our work now needs to be in the follow through. I could go on and talk about this topic for a long time, so I think I'm gonna try to rein it in here. One of the things that I'm working on now is figuring out how people cope with things, so how they approach religious coping, if that has an impact on their levels of stigma around mental health, and so that way we can see who may be more likely to feel stigmatized or have this internal tension about seeking help, and so that we can figure out good outreach efforts for them. So I think there's a lot of opportunity here. I'm excited. I am just so enthused about the possibility of more people getting the help that they need. And I'm excited about all the partnerships with pastors and leaders that will come, and I think that's going to also lead to people getting the help that they need. And so I so wish I could be there with the conversation, but please feel free to reach out and contact me. I hope I have answered your questions sufficiently, Candace. Take care and best wishes to you all. Thank you.